I'd like to welcome everyone to this webinar today. We're going to be talking about, hold on, give me one second. Dr. Agueta, are you sharing your slides? You're muted.
All right, can you hear me now, Martha?
Yes, I can hear you.
All right. Sorry about that.
No
When
worries.
I reloaded them, I can't see the chat or anything, so I'm in the dark here.
No, it's fine. Are you sharing your slide deck?
I am. Are you not seeing it?
I'm not seeing it.
Okay, let me go back here. Hold on one second. All right.
Oh, there it is. Thank you so much.
Okay.
Okay, here we go. Thank you everybody for joining us to our webinar today. We're going to be talking about addressing COVID-19 in at-risk populations with underlying comorbidities. My name is Martha Alvarado. I am the manager of online education and evaluation for Migrant Clinicians Network, who is co-sponsoring this with the National Hispanic Medical Association. Next slide, please, Dr. Ayeta. And quickly, we are interpreting this presentation. So if you would like to listen to this in Spanish, you can click on the little globe at the bottom of your screen that says interpretation. Click on it once. It's going to pop up an English option or a Spanish option. Select the language that you want to listen in.
By the
Likewise,
way, Martha, sorry to interrupt. This is Robert Hastings, the other interpreter. If you can
yes,
make me an interpreter and co-host, please.
Absolutely. Give me one second.
Sorry for the interruption.
No worries. All right, let's see. Okay, are we good? Robert? Okay, perfect. Where was I? Oh, yes. Okay, interpretation. If you want to listen in Spanish, click on the icon, the globe icon at the bottom and select English or Spanish, whichever you want to listen in. Likewise, if you want to view this presentation in Spanish, at the top of your screen, there's a little tab that says View Options. Click on that, and then you're going to see Dr. Gaeta's name there and English, and also Presentación en Español, that would be in Spanish. So click on the screen that you want to view so that it matches your listening language. Next slide, please, Dr. Gaeta. This MCN is accredited as a provider of nursing education, and we have also received accreditation from the American Academy of Family Physicians. So we will be offering 1 hour of continuing nursing education and continuing medical education for this presentation. And in order to claim credit, you must submit the post-evaluation at the end of the session. Next slide, please. And again, we have no relevant financial relationships that relate to this presentation, nor do we have any relevant financial relationships with ineligible companies whose products or services are related to pertinent therapeutic areas. Next slide, please. I'm just going to quickly introduce Dr. Gaeta. Dr. Susan Gaeta graduated from the University of California Davis School of Medicine in 1988. She currently works for the Department of Emergency Medicine at the University of Texas MD Anderson Cancer Center, where she does research in sepsis, advanced care planning, emergency medicine, and emergency medical care of cancer patients. She is board certified in internal medicine and is currently pursuing a master's degree in healthcare transformation at UT Austin and has been appointed the National Hispanic Medical Association Leadership Fellow for 2022-2023, the Center for Study of Latino Health and Culture, Accelerating Latinx Leadership Spring 2023 cohorts. Welcome, Dr. Agueta. Thank you so much for being here, and I'm just going to go ahead and let you take it away.
Thanks, Martha, for that welcome and introduction. And good morning to our folks in the West Coast. And then for the rest of you, good afternoon and buenas tardes para todos. And I've just kind of been looking at the chat, not just to call out people, but it's great to see some people from Texas since I'm here in Texas, and then also Oxnard, California, which is where I grew up. So hopefully you enjoy this lecture. Please feel free to stop me anytime, ask questions in the chat during the presentation, and I'll answer them as they come through. So the outline of my presentation today is to go over the current state of COVID endemic, screening recommendations, prevention, treatment, and what we're going to be talking about long COVID, which I think is very important for us to review. So this is the current COVID data. And if you look at this is the last day was October 21st, 2023. Here at the bottom is a website where you can go and get the data that is current, that's updated. I did not update our slides since I didn't want to have wrong information on 2 slides. But if you look at this, it's really encouraging that all our numbers are going down as far as, how many patients are being tested positive, how many people are coming to the emergency center with being diagnosed with COVID-19, and how many of them are being hospitalized, and then deaths. When I first saw this, I was really encouraged that our numbers are going down. However, I was concerned about our deaths that were increasing. And then this was for the past week. But if you go to the website and look at the most recent data, our numbers are plateaued on the deaths. So that's encouraging. Again, I encourage you to go here, because I know when I was looking at different sites, a lot of the different public health organizations and medical centers are not updating their information, since now we're in the endemic versus the pandemic, but this tends to be updated on a weekly basis on Mondays and Fridays. So this is a good source to kind of get to know what's going on in the United States. And then more importantly, you can drill down to your own city and state to kind of give you more up-to-date information. So as far as screening recommendations, if you recall, when we first started COVID-19 pandemic, a lot of people were coming in with loss of taste and smell, diarrhea. The most recent variants, the patient can still present with these symptoms, but what I'm seeing more and what's in the literature is people are coming in with fever, chills, cough, shortness of breath, or difficulty breathing. So my recommendations is, if you have a patient that you're seeing and they're, complaining of these 4 items that I listed in red, have a high suspicion for this. And then of course, doesn't mean if someone's coming with diarrhea with the correct history, it could also be COVID, but the other symptoms were more common with our earlier variants. And I'm just seeing the chat, is Spanish okay?
I believe so, yes. Thank you, Doctora.
Okay. All right. So testing, if you recall, when we started the pandemic, there was a lot of home tests being sent out. You could order them. And I'm glad to share that at least as of September 25, you could reach out to this website and get a new home test. They were for free. I have not seen that has changed, but go to this website. And of course, you can do a test at home, which is easy and it's rapid. However, there is a possibility that it could be falsely negative. So if the recommendation is, if you have symptoms and you test yourself, and if it's negative, to repeat it in a couple of days, because again, it could be falsely negative. And then for those of us who still have the free test from before, you can go to this website and to see if that test that's expired, whether it's still valid. So again, that way you're not throwing away those home tests, and potentially they can be used. Home testing is convenient and it's easy. However, there is a possibility of being false negative. And then if you're able to get a PCR test, that's usually done by a healthcare provider. They could do it at the pharmacy or in the hospital. And the benefit in some places, like my hospital, along with checking with COVID, it checks with other respiratory viruses like flu, which I know we're focusing on COVID, but just want to call out that I have a feeling that this winter we're going to have high numbers of flu, since a lot of people are not masking when I go around to public areas. So something to keep in mind as you're seeing patients or you're educating individuals that, yes, think about COVID, but also flu, and in the right population, RSV could be also what the patient may be having. And as far as prevention, I would like to say that there's been advancement, but still recommendations are, wash your hands, wear a high quality mask consistently, correctly, and emphasis on correctly, because I see people even in my hospital that, we're getting tired of wearing masks, but that is the best protection, and they're wearing, below their nose, they're covering their mouth, but their nose is not covering, or they're covering below the chin. So continue to wear that. I know we don't want to wear the mask, but it's the best protection. And then social distancing if possible, which depending on where the person you're talking to, the patient, that may be hard. And so if they can wear a mask or definitely wash their hands is the best recommendations in order to prevent COVID. As far as COVID-19 vaccine recommendations, I'm glad to say that, the expansion has been increased, that now that anybody who's more than 6 months old qualifies for a vaccine. Currently, right now, the 2 vaccines that are approved is the Pfizer BioNTech and the Moderna. And it's important that you can have any of these vaccines as long as it's been more than 2 months from a prior vaccine. That these vaccines are available for free. You need to go to your local health center website, state, local, also tribal websites, territorial health departments, and then pharmacies. At least right now, there's a CDC Bridge Access program that, at least from what I saw, it ends on 12/31/24, where you can still get the free vaccine. And then you can also go to vaccine.gov, which will give you information about COVID, as well as RSV and flu. And what I liked about this website is the information is both in English and Spanish, and it might be available in other languages, but I was just looking particularly in Spanish to kind of give you some information of the vaccines and where to find them. And then kind of focusing at, patients who are at risk, higher risk to have complications from COVID. The main one, when you look at the literature, is age. Age greater than 65 is the highest comorbidity that puts them at risk for having complications from COVID. Cancer patients are higher risk of severe infections, and particularly if the patient has blood cancers, which by definition are patients who have leukemia, lymphoma, multiple myeloma. Those are identified as blood cancers. The solid tumors are identified as lung cancer, breast, GI, and other cancers. So if your patient has cancer, they're higher risk and age greater than 65. Diabetes is also a higher risk, type 1 and type 2, so it doesn't really matter which one. They're both and give you an increased risk. Obesity, BMI greater than 30. And then I put here in children because the literature that I've been looking, especially at Latinos, is that our children are having obesity, and so that's increasing. So again, please keep an eye out on our children. If they're obese, they're at higher risk for complications. And then when you look at the literature, the more comorbidities. So if you have a patient who is 65, who has leukemia, who has diabetes, and is obese, they're much more at risk for having complications from severe COVID versus someone who is younger, doesn't have cancer. I know in the Latino population, hypertension is a common illness that we see in our community. Right now, in this particular study, it did not have increased risk, but something to keep in mind, because one of the things that I hope to share with the group is that literature is always changing and being updated. But for now, this is the most recent study. These are the comorbidities that cause you to have a higher risk.
Dr. Ayeta, there's a question that came in from Javier Mejia, who is asking if the vaccine is free or if someone has to have health insurance to get it.
So thank you, Javier. So I would encourage you to go back to this website here, because when I looked at it, they said free vaccines and recommended going to the health centers, and then particularly for pharmacies where, that's where most of us go get our vaccines, unless if you're in a community center, is there is currently a bridge access program, which would give you free vaccines. So I would say go to the health centers or the state website and see where you can find it. There is a picture, which I'm not sure if I have it in this slide deck. I'll look to see. But if not, Javier, you could send me an email and I could show you where you can actually put in your zip code and it tell you where to go get the vaccines. I think I included in the slide deck later on, but at the end, my email address is on there and I could give you the direct website. So thank you for that question. So I kind of alluded to health risk, and one of the things that I want to call everybody's attention, I'm sure, looking at the people that are here, you guys would probably have more experts than I am, but one of the things that looking at Latino immigrants, when I've looked at the literature, and then of course from my own experience, my father worked in the fields in California, and my grandmother was picking strawberries in Watsonville when she was alive. And healthcare access, many don't have insurance, so they may not go to the doctors to get their physical exam. So you may not know that they have cancer, diabetes, or be obese because they're not going. So keep in mind with the new recommendations for that vaccine is that it's not available for anybody. And so while you may educate, and that's one of the things that we've learned over the past couple of years when I've been working with the organization is that a lot of our patients in our community have mistrust of information. And so I think as we go in and talk to them is share with them that, well, they may not know what kind of medical problems they have because they may have not gone to the doctors, but it's family is important. So say, you want to get your vaccine because you want to protect your grandmother, your abuelita, your mom. So that's also what I would share with them. The other issue that I noticed when I was looking at literature they looked at all the pandemic during COVID, one of the biggest things that came up was mental health issues, and particularly with the Latina women at home, that, you have to keep in mind that they're at home, they're not going out. And so there was a study that showed that there was increased risk for depression and anxiety in Latina women in particular, the study showed. And so I know mental health in general is limited. When I was in a recent conference, people were telling me that they were waiting for months to get to see a psychiatrist. And for Latinos, I'm sure that number is even higher. So for our community health workers, keep this in mind as far as potential things that could you may see in our patients. And also, hearing a lot of things about social determinants and health. And when we looked at the Latino community, and Dr. Hayes Bautista has been doing a lot of research, and this is what I learned when I was doing the fellowship in LA, was that, we tend to be less educated, lower socioeconomic class. So by that, puts us in those higher numbers of social determinants of health. So again, these are the things to keep in mind, because they kind of all lead together. Is if we can't get our community members to the doctor, they don't know what illnesses they have. And so this is why having you guys kind of share this information and make it important to show with them that the vaccine is available for everybody that's greater than age 6 months.
And really quickly, Dr. Gaeta, just from our interpreters, if you could just slow down just a little bit, we'd appreciate it.
Thank you. I will slow down even more.
Thank you.
So here's a good website going back to the vaccines. It has good information to tell you who is, what age has it been approved for, and then how does it identify. So again, this is a lot of detailed information, but again, to help with the mistrust, if you share this with your patients or when you're educating, and this has if you go to this website, it has a lot of information. And this one particularly, what I liked about it, it was Hispanic health information on COVID-19. So I encourage you to go to this website because it has a lot more information specifically for Latino patients or Latino community. And then on here on the bottom, there is a Novavax here. I would kind of hold off on this one because so far the ones that I have seen are the Pfizer and the Moderna. I haven't seen the Novavax vaccine. If anybody has seen it in their experience in their different places, if you could put it on the chat, because it'd be interesting for me to look into it more, because I haven't seen it on any of the information that I've been reading. So here's, I mentioned to Javier about a clinic. And so here's a walk-in clinic here where what I like about it is, and this is in California specific, so I don't know if there's similar resources out of California, but what's nice about this here is you could put in the zip code of the person where they live at, and you submit, and you can dial here the radius, anywhere from 0 miles, I think, to several hundred, and it'll pop up that has a walk-in clinic that would be having the different vaccines. So this is a good resource. Again, I've only seen this in California. I have not seen it in other states. If anybody has seen anything in other states, please put in the chat so we can share it with our colleagues. And then as far as treatment, the main thing is that if the patient is positive with COVID, that they present, and this is where for the community health workers or promotoras, is to encourage the community individual to seek treatment, whether it's, to test at home. If it's positive, obviously you would want to get treatment, or if it's falsely negative, as I mentioned, repeat a test in 3 days, or go to your local community clinic and get tested, because these treatments, you want to get tested. If you're going to get treated, it's within the first 5 to 7 days. These are the 3 treatments that are approved. However, to go into more detail, Paxlovid is an oral agent, and it is approved for adult and children's ages 12 and older. There is many drug-drug interactions that you need to consider before this is prescribed. So in the next slide, I'll show you a good source where to look for drug-drug interactions. Another agent, Lagevrio, the generic name is Molnupiravir, is only approved for adult. However, this one I would caution to use. The first choice, if you need to give someone a treatment, is Paxlovid, because Lagevrio has, when they did research studies, it was a very weak recommendation. They just have it there in case that if you cannot find the Paxlovid or the Remdesivir, the Cori, that would be your third option, but it's a very weak recommendation. And I know some of my colleagues from my cohort from the NHMA fellowship, they were doing this work policy, and they were telling me that a lot of the treatments were not available. And this was a year ago. So I'm not sure if these treatments are available still now, or they're having some problems. But these are the current recommendations. Remdesivir is an IV infusion. Depending on the community, you could have this done as an outpatient. It's 3 infusions, 1 every day, versus having an inpatient. The Paxlovid and Lagevrio are both oral pills that are done as an outpatient. All of these 3, keep in mind, is to prevent COVID to get worse, severe, and potentially death. It does not prevent you from getting COVID, so it's a treatment. So that's something that's very important to communicate with the community members, that this is to help you to get the symptoms get better, not actually cure it. And so I see a question here from Javier. And what day is it better to do? So the recommendations is 5 to 7 days. The earlier, the better, is to start treatment. So that's why it's very important that when we're sharing with our community, if you recall the symptoms that I shared in the prior slide, is not necessarily that they're going to have COVID because they have a cough, a fever, runny nose, but to have a high suspicion that this could be COVID, and they should get tested, because that way if they're tested and they are positive, and they're at risk for having, severe COVID, that they should try to get these treatments within 5 to 7 days, but the sooner the better. And then as far as the monoclonal infusion, same thing, this 5 days, and the earlier the better. And again, it's not to cure COVID, but it's to prevent hospitalization and severe COVID infections. So keep that in mind, because there are patients, I know when we were first using this treatment at my hospital, they're like, well, I'm still feeling sick. It's like, yes, you're still going to feel sick, but the whole idea is that we prevent you from getting sicker and potentially dying from COVID, or requiring advanced life support, like being placed on a breathing machine. Hopefully I've answered the questions, Martha. Let me know if I missed any.
Yes, thank you.
So here's another website that is very helpful. It kind of is I like clinical decision aid supports, because it helps you as you're sitting there looking at the patient that's in front of you. Is like, which is the best treatment So I encourage you to go to this website here. And if you look on here, it says, is the patient hospitalized due to severe COVID? Yes. And so then, as I mentioned earlier, these are for patients that are outpatient. So if you're inpatient, you're not going to be using the oral agents. You're going to be using the infusion, which, again, depending on your hospital system, you could have it infused as an inpatient or as an outpatient, but it has to be 3 successive days. If the patient does not have your severe symptoms, in this particular guideline says if your oxygen level is less than 94%, respiratory failure, sepsis, which is, if you have an inflammatory response to an infection, or if you have multi-organ failure. So if you don't have any of those, and again, if the symptoms are within the 5 to 7 days, the caveat is that the earlier the better. These are the treatments that are recommended. And again, they're oral treatments. And then there's the IV dose that I mentioned. You have to do it successfully in 3 days. So this is a good resource to help you kind of say, okay, which one does my patient fit? And then they kind of wash you through in recommendations. Here I alluded to that Paxlovid is the best treatment right now that's oral. But one of the things is that there's a lot of drug-drug interactions. And, if you do not have a benefit of having a pharmacist with you in your department or in the community, this is a good one. It's the University of Liverpool. And what's nice here is you put in which medication you're going to be giving for COVID. So in this case, you would be doing Paxlovid. You would enter it here. And then you would enter all the different medications that the patient has. And then it'll tell you what the drug-drug interaction. So for instance, a lot of our patients may be on a statin. And so a statin will pop up here as a drug-drug interaction, and it gives you information like how long do you need to hold it? And then what you need to do with this information, then have a conversation with the patient. For instance, one of them is a blood thinner, a Pixaban. And so if a patient had just been diagnosed with a clot in the lungs versus they've been on it for a while, you would have to have a conversation, say, okay, there's a risk that this medication could affect this. And if we hold in this case, the blood thinner, especially if it's a newly diagnosed clot in the lungs, there might be some more complications. So it's having that conversation. And again, this is a great resource to look into as far as the drug-drug interactions when you're having that conversation with the patient as far as starting to treat. And then that's a great question, Javier. How many days after being positive can you return to work or school? So the last recommendations I saw was 10 days if you were infected. Now, there is some instructions depending on, for instance, in my hospital, if I'm exposed to someone like my son, then if I'm not symptomatic, I could go back in 5 days. But if you're positive, it's usually 10 days. I have not seen anything sooner than 10 days. And then they always say during those 10 days, after you return, they encourage you to wear a mask and, wash hands just like before to try to prevent it. So one of the things that I kind of alluded is, we are now in the COVID endemic. But however, as you recall, when we started with the COVID pandemic, we had a lot of cases, and there's a lot of, we're still learning. And one of the things that you may hear is long COVID. Some people will call it post-COVID conditions. Some will call it long haul COVID. Some will call it post-acute COVID-19. Some will call it long-term effects or chronic COVID. So when you're looking at the literature, when you're talking to people, you could see any of these words, there has not been any consistency. But it doesn't happen in everybody, but it is something that we're seeing. And what you want to keep in mind, this is a patient who's had COVID, and it's been more than 4 weeks after the initial infection. Sometimes you can see them get better, and then 5 weeks later, they start having this cough, or some of them can have the acute infection is over, but they have this lingering cough. In my case, I got COVID in January, and I had a residual cough for almost a good 6-7 months. And I did have lung COVID. I needed to go see my pulmonologist, and I had to do pulmonary rehab. So this is something that you might see either in the patients that were newly diagnosed with COVID, or the ones that have been had COVID in the past for at least 4 months ago, and they're like, I'm still having this cough, or it could even be months or years. So something to keep in mind, again, as we're learning and doing a lot more research on this. Some of the risks that put you at risk for long COVID, if you've never been vaccinated. So again, this is something, as you're educating your community, is again encouraging them to get vaccinated. So if they do get COVID, you have to tell them that, even if you get vaccinated, you can still get COVID, but hopefully with a vaccine, you're at less risk for having long COVID. There is increased risk if you get reinfected, and you may be seeing out in the community that someone was positive and then several months later they got another infection. And it's always questionable, is it a new infection or is this long COVID? It depends on what tests they're doing. The PCR, at least at our hospital, so I encourage you to find out where they're getting their PCR, what the exact details of that test is. You can shed the virus for at least 3 months, so we don't check a repeat COVID test till 3 months later. And then some of the symptoms, they could be very fatigued, they can have fever, respiratory and heart symptoms, having difficulty breathing, cough, which is kind of what I experienced, having chest pain, neurological symptoms. Some people, I've heard some of my colleagues, it's like, it's harder for me to think. So there's something that's called brain fog. Headaches, I haven't seen as much. Digestive symptoms, diarrhea, stomach pain, and then some other symptoms, joint muscle pain, rash. You can have changes in your menstrual cycles. So what I would say on this is, if you're not sure, if you've seen a patient and you've done, you checked them to make sure that there was nothing else going on, potentially this could be long COVID. One of the things that when I was looking at this to get more information, it said that patients, if they get tested, they may have never had symptoms, or they may have never had a positive test, and they could still have long COVID. So we're still learning. There's here 2 websites, covid.gov, that gives you a definition, and then saluamedica.org. I like, because it's, again, has more information, secondary, more detail for Latinos and the Spanish community. And I see a question here from Christina: are COVID tests safe in detecting new variants? So far from the literature that I've seen, the current tests that are out now are able to detect the current variants. Now, as new variants come out, that's something that we always have to look to see if that test is on there. And so the places that I would say, again, as I alluded at the beginning of the presentation, a lot of the websites are not being updated. And so the ones I would tell you go to is your CDC.gov, COVID.gov, and NIH. Those, at least at the moment, they're still being updated with up-to-date information. A lot of the state websites I see that are not being updated. And I think that was the only other question I saw there. So I've alluded that, we're learning a lot about COVID, and I just wanted to share this. I'm not involved with the study, but this caught my attention while I was doing research for this presentation. Is, as we know, Hispanic Latinos, we're more at risk for getting COVID, and then also having the risk for long COVID. And so we need to learn more. So this is a study that if you do interact with patients who have had COVID and you suspect that they have long COVID, encourage them to enter this study, so that way we can learn and be able to have more detailed information for our Latinos, for our community, as far as what are the symptoms, what are the treatments, and especially with our migrant workers, if you just think back to the symptoms, if you're out in the field and it's hot and you're coughing, and you have difficulty breathing, that's not a good thing. So it's very important that we participate in these studies, so that way we can learn, what is the outcomes, what are the treatments available, so we can help our community. So I encourage you to enroll your patients in this study. Again, I'm not involved in the study, but I think it's very important that we do enroll ourselves in these studies so we can get information, because often when I'm in the emergency department and talking to people about treatment, a lot of this research is done in non-Latino, non-minority, so it's kind of hard to interpret. Usually when I have a conversation with my patients, I say, well, this is what the studies show, but it was not someone like us. And so this is why it's important for us to get involved and participate in studies.
Thank you, Doctor. I
Mhm.
was wondering if you could talk, sorry, I was wondering if you could talk a little bit about the social factors that lead to the comorbidities and increased risk of COVID. There's a lot of health impacts like higher risk of diabetes that comes in part from poverty, immigration, racism, environmental exposures, things like that. And the factors themselves increase the risk of COVID. So I was just kind of wondering if you could speak a little bit to that.
Sure. So there's a lot of, misinformation out there. And this is something, again, I mentioned Dr. Hayes Bautista, who, I had the honor to learn from him when I was doing my fellowship in UCLA. It's a CESLA community. Whereas, when they labor Latino patients with all the minorities, they say, oh, we're the, like everybody else, we have these conditions. But in reality, when you look at the data and what are the risks that we have, it's cancer and diabetes. There is not one answer. There's been some, concerns that maybe as we become more acculturated to being in the United States, our diet change from, when we came from Mexico or any other Latino community country. So that's one thought. The other thing is also, what are we doing as far as our work? What they've done is that looking at if you do not have access to healthcare, you may not be able to go to the doctor, where they may not, be. So when you go to your physician, they might say, oh, Susan, I see that you're gaining weight. Let's check to see if you're, pre-diabetic, and, recommendations from that. So that's one of the things that I've seen. And then also looking specifically at migrant farm workers who are working in the fields, while it's labor intensive, while they're working, depending on what they're doing. But if you think, and I know from my own dad, when he came home, he was exhausted. So the idea of, exercising to help with the weight might not be there. And then also the things that I've noticed too is depending where that person lives, they may not have access to healthy food. There's a term that's called desert stores. So, they're one, they may not have a supermarket there that has healthy food, or if they do go to that market, it might be too expensive. So those are some of the things as far as for diabetes and obesity. For cancer, there's a lot of research going on. Some of the things that I've seen is the pesticide that is put on the plants puts us at risk for cancers, especially more the leukemias. The solid tumors, I haven't seen as much data as far as pesticides, but for solid tumors, I would say that would go with, again, trying to, go in, getting access to healthcare, to be seen, to be screened, like for colonoscopies for colon cancer, you want to get your scope at age 50. And then if you have higher risk factors, you want to have it done earlier. So those are some of the things that I come to mind. Martha, what else did you ask me?
Just to talk about if you could just address the poverty, immigration, racism, environmental exposures, things like that lead to the increased risk.
So poverty, I think that goes in hand with, having no access to healthcare. I know, we had the insurance that was out in the public market. And I do remember from my own personal experience when I was exploring something back in 2018 that, if you go into the website and, I have a lot of knowledge, it's hard to find an insurance. You can find insurance, but then I remember if you go to the doctors, there's a sign. I remember taking my son to the pediatrics and it's like, we don't take market insurance. So that's one of the barriers. I haven't seen much improvement, and I haven't heard, improvements. I know in California, where I'm following a lot, there is a new law that was just passed, my understanding. And I know there's some people from California, please correct me, is that now people who are immigrants and also illegal immigrants may qualify for Medicaid. I have not looked at the particulars on that, but when I saw that, that was encouraging, that this will help us with access to care. But of course, one thing is having the insurance, is having clinics and hospitals take that insurance, which is a whole different matter. So from that perspective, as far as racism, I would say I'm not an expert at that, but what I have learning is that, you know, and I've alluded this throughout my presentation, there's a lot of mistrust from our community as far as, you know, medical care and, you know, and information. And so I'm glad to see that there was a lot of community health workers, a lot of promotoras, because you are the ones that that person that's going to be in the community is going to trust, because you're there in the community, you're talking to them. So I'm glad to see people here, because hopefully I've shared some information that you can now take back to the community and say, you know, this is what I've learned. And, you know, and then also I try to be very vigilant of giving you websites, so that way you can go there and get the information that you need, that you can tailor for the community. But I think that's kind of from a racism perspective, what I've learned when I've talked to people, gone to conferences and read about structural racism.
Thank you, Doctora. I'm going to go ahead and open up the mic for anyone that wants to ask Doctora Gaeta a question. Feel free to just raise your hand and I can unmute you.
And you can do it in Spanish too. I speak Spanish.
Yes.
And also for those who, I know there's a lot of knowledge here. Please share with the group, unmute yourself if you also have some knowledge of something else that's working out in the community. Again, I've looked at a lot of stuff from California. Here in Texas, unfortunately, it's not, the services are not as encompassing as in California.
We do have quite a bit of promotoras here. If any of you want to tell us a little bit about what you guys are doing in your communities or anything like that, we definitely welcome that information. In the meantime, if you guys can go ahead and take the time to take the evaluation, just go ahead and scan the QR code with your phones. And I'm also going to be sending you the link to the evaluation later on today, just in case you don't have your phone handy. And Javier has raised his hand. Let me go ahead and unmute you, Javier. Give me 1 second.
And while you unmute Javier, Martha, there's a comment from the Q&A from Hortensia. And let me read this in Spanish to myself, and then I'll answer it in English. So the question from Hortensia is if she's currently receiving rituximab, which can be used either for patients who have rheumatoid arthritis, or sometimes some of our cancer patients can have this, can they receive the COVID-19? And so what I would say in that case is I would recommend that they check with either their oncologist or the rheumatologist, because yes, they can receive COVID-19 vaccine, but you would want to make sure that you do it at the right time between infusions. And so depending on how often they're getting the infusion, and then also what else are they getting with infusion? Because like I said, our cancer patients do receive this as part of some of their chemo regimens. So yes, you can do it, but I would encourage you to have that person check with their oncologist or the rheumatologist or whoever else is infusing the rituximab.
Thank you, Doctora. And Javier, go ahead and ask your question. Javier, puedes preguntar tu pregunta.
Bueno, ¿sí se escucha?
Sí, Javier.
Gracias. Y la pregunta es que todavía existe, la gente, veo yo en los eventos que tenemos, que estamos promocionando que la gente continúe con su vacunación, pero hay mucha gente, muchas personas que siguen renuentes con la vacunación, incluso diciendo situaciones como que no, luego dicen, no, y es que si me enfermo y si me va a pasar esto, la recomendación que siempre hacemos es que va a estar si se llega a enfermar, o sea, no garantiza la vacuna que no se enferme. Lo que garantiza o lo que ayuda es para que no desencadene casos graves de COVID que se ha internado. Pero también lo que nosotros no insistimos mucho, o sea, los invitamos a que se vacunen, pero respetamos siempre la última decisión de las personas, porque muchas que se van a hacer zombies y cosas por el estilo, pero bueno, la gente continúa así. Ahora que la vacuna ya tiene un precio en las farmacias, porque creo que solamente los que no tienen servicio médico califican para vacunación gratuita. Entonces, ya hay un poco más gente interesada en ponerse la nueva vacuna cuando no tienen servicio médico. Gracias.
So thanks, Javier. I'll answer this in English, and then I know our translators will translate. So yeah, those are good comments. And so what I would tell you, and this is what I've done, my personal experience, if you encounter someone in the community or a patient, ask them, why are they hesitant? And, and just ask that question in a nice way and listen to them, because you'd be surprised what they'll tell you. I know my personal experience, I had one of my clerks that said, I don't want to get the vaccine because I've been told that I can die from it. So I sat there and listened to her and, kind of inquired what it was that was going on, what information. And, I've mentioned before that, a lot of people are hearing misinformation. I mean, if you open up Facebook or WhatsApp or, whatever social media, there's always someone there publishing something or saying, oh, this is not on there. So one, and I think you're doing that, is listen to them. And sometimes I agree with you wholeheartedly. You cannot force them to do it, but sometimes it takes a couple of conversations. In the example I gave, I think I spoke with her twice. And then the third time she came to me, she's like, hey, Dr. Galletta, I've got the vaccine. So I think by getting as much information, listening to them and sharing that with them, I think you may convince them. Of course, the other thing is, I kind of mentioned, at least for the Latino community, our extended family may live with us. So, as you're right, yes, the vaccine won't prevent COVID, but hopefully you won't get sick. But more importantly, you won't hopefully spread it to someone else, like your abuelita, that 80, 90-year-old abuelita who, if she gets COVID, she is at higher risk and could potentially die from that. So that's one to approach it. But again, you have to respect their wishes, but kind of just listen to them and see what is it that is causing them concern about the vaccine, and then educate them. As far as the prices for the vaccines, again, my understanding is that there is free vaccines. I think of it, if I wasn't mistaken, you're in California, so I would encourage you to go to that site. And because again, California seems to be more ahead of the rest of the United States, where you can get free vaccines. And when I was looking at that walk-in clinic, it said you did not have to have insurance. Again, when I was trying to put it in, if you go into the website, you have to enter the information and actually like to set up appointments. So I didn't go all the way through the website, but that was when I was reading. That's what the information I got from that. So hopefully that's valuable information and answers your question, your comment.
Thank you, Doctora. Does anybody else have any questions for the doctor?
And I
Well,
put my email. Sorry, Martha. I put my email address there, so in case if after you go back and you think about she said this, or I try to go as slow as I can, but I know I do I speak fast when I get excited. Feel free to send me an email. If I don't have the answer, I can reach out to a lot of my colleagues, across the United States to get that answer for you. So please, my email address is there in the chat, and I'll be glad to get more information for whoever has questions or anything I can do to help out. Go ahead, Martha.
Thank you, Doctora. Gladys, I'm going to unmute you so you can ask your question. Go ahead.
Sí, gracias. ¿Me escuchan? ¿Me escuchan? Sí, ahora.
I couldn't hear the question, Martha. I don't know if you were able to hear it.
¿Escucha? Poquito.
Gladys, un poquito más fuerte porque es duro para oírte.
Ok, gracias. Quería preguntar si cuando nosotros hacemos alcance a la comunidad, hay gente que todavía no tiene el programa de NYC Care y no tienen estas personas acceso para poderse vacunar o necesitan el programa necesariamente para la vacuna.
So Gladys, no entendí qué programa era.
El NYC Care.
So no, I'm not familiar with that program, but if you could put in the chat, maybe some of our colleagues might know. Again, for the vaccines, depending on where you're at, my understanding it should be a free vaccine and you don't have to have insurance. But if you want to put in the chat where you're located at, maybe I can get some information to you. NYC Care. So I'm assuming that's New York City.
Sí,
Is
es
that
en New
correct?
York.
Okay, so let me look into that because again, when I was looking, this was more on the California, but I'll look to see unless if someone else is here from New York can answer Gladys's question.
Yes, anybody here from New York, if anyone has an answer to that question, we'd appreciate it. Thank you. In the meantime, I'm going to go ahead and unmute Maria. So Maria, you can ask your question. Go ahead, Maria.
Sí, yo tenía una pregunta acerca del estudio. Quiero estar segura si lo entendí bien o estoy mal, que me corrijan. El estudio es para las personas que tuvieron COVID y luego después volvieron a enfermarse, o es otro, o porque no lo entendí muy bien a lo que leí ahí. Entonces quisiera que me lo explicaran para hacer, bueno, les voy a hacer la otra pregunta. ¿Qué rango de edad tiene el estudio? O sea, ¿tienen un rango de edad para participar en el estudio o cualquier persona que sea latina puede participar? No importa la edad. Gracias.
I'll answer this in English and then our translators can do it in Spanish. So Maria, if I understand correctly, you're asking about the long COVID studies. And so I would encourage if you have a person that wants to enroll in the study to go to the website, because some of the stuff I saw that you did not have to be positive for COVID, because sometimes you can still have long COVID without being tested. But I would encourage to go to the website. It's both English and Spanish. And it's for adults. I didn't see anything for children right now. However, I know there are people studying long COVID in kids, but this one is for adults only. And it's after you had COVID, and it looks like when I was looking at it, it was more than 4 months. But to have the particulars, because I'm not involved in the study, is to go to the website and to get more information to see if whoever you're wanting to enroll is able to qualify for the study. And let's see, Ginger is saying that in the Hispanic community who don't have documents and don't have insurance, medical insurance, or a program of health, they can get the vaccine. But let's see. So I think if I'm correcting this, Ginger, but feel free to unmute yourself, or Martha would unmute you. You're trying to tell us that you don't have to have insurance and you don't have to be a legal immigrant is what I'm reading as this, but I may be interpreting it incorrectly.
O sea que las personas que no tuvieron COVID o que tuvieron un COVID largo es lo que no.
So this, to answer Maria's question again, the study is supposed to be for long COVID. So by definition, you've had to have COVID. But when I was looking at some of the information, it said, even if you had never tested positive. So again, if you have a patient who's interested in being enrolled, I would recommend going to the website and getting more information as far as what the inclusion, who can participate in the study and which individuals have to be excluded from the study. That way you're having the most up-to-date information.
Thank you, Doctora. So we have just a couple more minutes
correcto, ya
left.
entendí.
And I just wanted to let everyone know that I will be sending you all a PDF version of the PowerPoint presentation in both English and Spanish, and also the links in English and Spanish of the recordings. Again, if you want to receive a certificate of continuing education, you must submit the evaluation, and I'm sure that Doctora Gaeta can answer any other questions. That she provided her email, so if you guys have questions for her, I'm sure you can email her directly. You can also email MC, and you can email me. I'll stick my email on the chat. You can email
Pueden
me and
mandar las preguntas en español si quieren también.
yes, thank you, Doctora. And if you prefer to email me, and I can reach out to the Doctora Gaeta and ask questions on your behalf, I'd be happy to do so. Once again, I'm going to be sending everybody a follow-up email with all kinds of links from this presentation. So if anybody else has any other questions before we close, Doctora Gaeta, I want to thank you for being here. It was wonderful having you.
My pleasure, fue un placer, and whatever I can do, and hopefully this was helpful, and feel free to send me questions, comments, because this is important to me. I mean, I'm Latina, and my dad, like I said, and my other relatives have worked in the fields. So this is important to whatever I can do to help out.
Thank you. Thank you so much. And thank you everybody for being here. Take care, everyone, and have a good rest of your week. Thank you, Doctora, once again. Oh, and thank you to our interpreters. Thank you so much. Greatly
Yes.
appreciated.
Thank you.
Thanks. Bye, everyone.
Martha, thank you so much for
Thank you.
everything. Feel free to tell me, what could have been better, because like I said, it was hard putting these slides together, try to
Yeah,
have
no,
more
I understand.
information.
Yes, yes.
All right.
We really
Bye-bye.
appreciate it. Thank you, everyone. Thanks, everyone. Bye-bye.